Bismillahirrahmanirrahim. So I'm going to explain some of the X-rays that we commonly see in the ward. Now, what abnormality do you see in this X-ray? Can you appreciate this thing? This patient came with the chief complaints of fever and productive cough for the last 10 days, and the fever is not responding to the antibiotics. So what is this? There is an air fluid levels. We are having the air fluid levels. This is the air fluid level, and we are having actually air above that. So we are having a cavity. There is a closed space with the air fluid level. So this is a typical example of lung abscess. Lung abscess. So this was actually a case of pneumonia that led to the failure of pneumonia, and that led to the lung abscess. Lung abscess is actually one of the complications of the pneumonia. So start this patient on a clindamycin, and that resolved. Now, in this X-ray, what do you see? What is your first impression? So if you see the trachea is shifted toward the left side, and there is complete white out of the left lung. So complete white out of the left lung with the trachea being shifted ipsilaterally, and there is hyperinflation of the contralateral side. So what is this thing? This is actually either the left lung collapse or the left pneumectomy. So the history will further guide you. So you have to keep these two things in mind. A patient is having this type of X-ray, trachea is shifted toward the left with the complete white out of the lung, pneumectomy or lung collapse, depending upon the history. This was a case of pneumectomy, previously operated for lung. His whole left lung was removed. Coming toward next. Now, what do you see in this X-ray? Now, the basic principle of X-ray is you must study the X-ray in the context of the history. And when you take the X-ray, the first impression a pulmonologist or radiologist get from this X-ray, that is volume loss on the right side. Normally, the volume on the right side is more as compared to the left side. So, but if you see here, there is a volume loss on the right side, and you see an opacity in the right upper zone. If you see this opacity in the right upper zone with the volume loss, this is actually right upper lobe collapse. Right upper lobe collapse. Coming toward this X-ray now, focus on this X-ray. Well, you can see a lot of abnormality, but you have to pick that abnormality which is clinically significant. Now, if you see in this X-ray, what is this thing doing? In the right middle zones, there's opacity. Coming toward the same X-ray in the lateral view. Now, what is your diagnosis? Can you see this opacity? This wedge shape opacity is actually collapse. This is lung collapse. This is right middle lobe collapse, and the right middle lobe collapse looks like this on the lateral aspect. This is the wedge shape opacity. This is the frontal projection. You can see only the opacity. The volume loss, you cannot appreciate that much volume loss in the middle lobe collapse. But if you see in the lateral aspect, so when you see opacity in the right middle zone, always go for the lateral opacity, for the lateral projection, because of the lung collapse you can see in a wedge shape. Coming toward the next X-ray. Now, what do you see in this that is already labeled? So can you see this extra thing? So there is a heart behind the heart. What does that mean? This patient is having 2 hearts? No, this is actually a case of, now the history is this patient is having fever for the last 20 days with productive cough and shortness of breath. This shows the left lower lobe collapse. This is actually the collapsed lung. This one. This is the collapsed lung. A heart behind the heart. What is another closed differential? If you see 2 heart borders, one is the left lower lobe collapse, other is hernia. The stomach goes upward, but there will be air fluid level in the chest. What is the third diagnosis? Esophageal dilatation. If there is a focus, if there is a esophageal carcinoma that has obstructed the lower end of esophagus, you can see air fluid level behind the heart. So the left lung collapse, the hernia, hiatal hernia, the esophageal dilatation, but in the esophageal dilatation in the hernia you will see air fluid level. But this is a typical example of the lung collapse, left lower collapse. Now what do you see in this X-ray? Now can you appreciate volume loss in this? If you focus in the right lower zone, there is volume loss with the slight shifting of trachea towards the right. What does it mean? It means there is a right lower lobe collapse. Now what do you see in this type of X-ray? Now there is actually volume loss on the left upper zone. Can you see this? There is opacity and there is volume loss. When you see an opacity and also there is volume loss, think of collapse. This is the left upper lobe collapse. What do you see in this X-ray? Heart is pushed toward the left and there is volume loss. Do not forget this simple thing, volume loss. Now if you see the left lung, there is volume loss, especially in the left lower zone. So this is actually again the left lower lobe collapse. So what abnormality do you see in this CT? And this is commonly seen in our wards. Can you appreciate this thing? There is opacity that is surrounded by black air. Opacity with surrounded by black air. Black air. This is called crescent sign. This is actually that crescent sign we talk about on the CT film, and this is diagnostic for aspergilloma. So this patient is having aspergilloma. This is actually that solid opacity and that is surrounded by black air. That black air, this is actually called crescent sign because crescent from moon, thin moon. So this is again a crescent sign. So this is typical for aspergilloma. And on the left side, can you appreciate this thing? What is this? This is invasive aspergilloma. This is invasive aspergilloma. How can you differentiate between the two? In invasive aspergilloma, can you see this? There is a solid opacity that is surrounded by lines that is surrounded by decreased opacity. You are having a high density, you are having increased wideness, then going toward periphery, the wideness is decreased. It means this aspergilloma is spreading. This is spreading. Crescent sign means this is usually localized. This is called crescent sign. That is for aspergilloma. This is called halo sign. Halo. The halo sign shows invasiveness. This is invasive aspergillosis. And halo sign means you are having opacity, and around the opacity you are having decreased density. It means that this is spreading. So this is a halo sign, and this is for invasiveness. Now what do you see in this X-ray? CT and X-ray of the same patient. Can you appreciate this thing in the left upper zone? So the two differential are TB, another is aspergilloma. TB, aspergilloma. So this was the case of aspergilloma. Coming toward this, can you appreciate the opacity bilaterally and to the sides of the heart, sparing peripheral zone? This is called perihilar opacity. Infiltrates in the middle and lower zones, especially in the perihilar region. The volume of the lungs are relatively spared bilaterally. There is no volume loss, and there are opacity. There are ill-defined opacity, which indicates mild infiltrates bilaterally, sparing the peripheries. So what are the three differentials? One is the pneumocystis cerevisiae. Second is pulmonary edema. So these two must be kept in mind. So this was the case of pneumocystis cerevisiae pneumonia in HIV patient. So if you see perihilar distribution, pulmonary edema, but that will give you a definite belt wing sign. Another is pneumocystis cerevisiae. Coming toward next, now what do you see in this? This is a very important X-ray, and we must focus on this. Can you see the hilar lymph node? There is bilateral hilar lymphadenopathy, and if you maximize the X-ray and you focus, there are small nodules. Compare They are tiny nodules. They are very small 1 mm nodules. So the nodules are scattered throughout the lungs and their bilateral hilar. What comes to your mind in Pakistan? Miliary tuberculosis. So this was the case of miliary tuberculosis. So if you see normal X-ray, there are no nodules. But if you focus on this X-ray, you will appreciate small nodules. So this is a typical example of miliary tuberculosis. Now what do you see in this X-ray? There are infiltrates on the right, in the right lung and the left lung. This is actually bilateral pneumonia. And the bilateral pneumonia is typically seen in the atypical pneumonia. And the example of atypical pneumonia is viral pneumonia, mycoplasma pneumonia, legionella, and chronic eosinophilic pneumonia. These are actually the atypical pneumonia. And in the atypical pneumonia, the patient is clinically not that much deteriorated as much the X-ray. The X-ray is out of proportion to the patient's symptom. If you see the X-ray is very bad, but if you see the patient is not that much deteriorated. Now what do you see in this X-ray? Can you appreciate this thing? Wide mediastinum, coming toward the CT of the same patient. What is this? This was a case of lymphoma. This was a case of non-Hodgkin lymphoma presented with the wide mediastinum. So these were the common X-rays that we see in the ward. So we have to focus on these X-rays. Thank you for watching.